So as we said, we are going to have another clip about yellow fever. This is our last clip. Still Modrik's is the name, and that's the YouTube channel where all the information will be found after this presentation. And as for today, as we wind up the topic of yellow fever, we are going to explain the management of yellow fever, list preventive measures for yellow fever, list the persons who are not eligible for the vaccine, and lastly, mention the complication of yellow fever. If we answer these objectives, then we shall have gotten the key ideas we need to know about yellow fever. So strictly, I'll just remind that yellow fever, I said, is a viral hemorrhagic disease that is caused by arbovirus, and this arbovirus is transmitted by the mosquito. These are two conditions. Like for malaria, still mosquitoes transmit. Also for yellow fever, they are the mosquitoes that are transmitting the disease. So let us start with the management of yellow fever. We are saying there is no cure for viral infection itself. So treatment will focus on symptoms. Yellow fever is a viral disease. So we don't have any specific treatment for all viral diseases. And if we are to treat this patient effectively, we need to look at the signs and symptoms this person is going to possess with. For example, one of them is fever. So as a health worker, we shall now focus on how to manage this fever by either opening the windows, keeping sponging, offering a cold drink, and lastly, we can administer antipyretic drug, for example, paracetamol. And here we shall be managing the fever that is in this yellow fever patient. We can also go to muscle pain and apply a warm compress at the site where pain is severe. We can give analgesic drugs. But as we give these analgesic drugs, we need to know that there is a risk of internal bleeding in this yellow fever patient. So the analgesics of choice shouldn't be the ones that promote bleeding. For example, if you give aspirin, you give diclofenac, these drugs are anticoagulants, and they're going to make this patient to bleed more. So in treatment of yellow fever, we try to avoid all anticoagulants, and instead we give coagulants like tranexamic acid, so that it brings coagulation and this person gets to have bleeding stop. Still, we saw that in this patient with yellow fever, there is dehydration. So as someone who is dehydrated, we are going to look at how are we going to control this, because dehydration comes with many complications. So we are going to offer drink enough of plenty of oral drinks so that this patient can have fluids restored. If we can't take orally, we can pass an NG tube so that we can pass the fluids via the nasogastric tube. And where possible, if dehydration is moderate or severe, we start IV fluids, normal saline and Ringer's lactate, and these fluids will even help to correct the electrolyte imbalance. Without forgetting that this patient, we need to monitor on the fluid balance chart as we have started the fluids, and ensure that we don't overhydrate because it may cause hemodilution, and we monitor the output, because if all is retained, we may end up causing edema. So as we look at this patient with yellow fever, you realize that we are managing symptomatically. So we shall look at all those symptoms, and this patient can be managed in the hospital. And that's what we say. Most times, people's yellow fever should be hospitalized so that we can closely monitor them, and we see that all the symptoms they possess are well managed. If we do that, we shall have our patients improve, we shall have our patients healed, and shall have our patients get chance to fight yellow fever against their bodies. That is the brief management that we can talk about if we have a patient with yellow fever. Then we are going to look at the preventive measures for yellow fever. How can we prevent this yellow fever from moving into our community. As we well know that yellow fever is common in the tropics and worldwide. It takes 44 countries that are now endemic of yellow fever. One thing is surveillance. Surveillance, we say that that's the continuous collection, analysis, interpretation, and dissemination of data about people's health. So individuals will go in the field to search all this information so that we can get the basis of the incidence and prevalence of this yellow fever. Then another thing that we shall do to prevent is vaccination. There is already a vaccine available where a client who haven't contracted yellow fever can be vaccinated and hence gets immunity against yellow fever. Then we talk about vector control as another measure to prevent yellow fever. We have seen that mosquitoes are the ones that are spreading this yellow fever. So when you talk about vector control, it simply means you are going to see the way to eliminate these mosquitoes so that they should not carry this yellow fever to humans. Then another thing that you're going to do in prevention is risk communication. We create awareness among the people in the community so that they can see the preventive measures we are talking about and even start to implement them. And lastly, in preventing yellow fever, we are going to restrict movement, international travel and trade restriction, so that people, if they remain in their countries, or if they are to travel, they should pass certain criteria so that we know that they are not going to spray yellow fever to other countries, or they have already gotten the vaccine. And this is already in place to see that yellow fever doesn't spray, because this is an epidemic-prone disease. Other preventive measures, as I almost wind up, we have to use the right insect repellent. This insect repellent is going to kill the vectors, which are mosquitoes and are the ones spreading the disease. As for malaria, we need to put on long-sleeved clothing or long clothing to cover the arms, hands, legs, and the head to protect yourself from the bite. We are saying we have to use screens on the doors and the windows, and even nets on the bed to keep these mosquitoes away. And lastly, as we are to prevent yellow fever, we should avoid the outdoors during peak mosquito hours. Peak mosquito hours, that is dark and down, early in the morning and late in the evening. Those are the hours mosquitoes are now so many and they are trying to bite. So those hours we should avoid being outdoor. We should be in the houses so that we should not be accessed by these mosquitoes. Who are the persons not eligible for the vaccine? As I've said, the vaccine is there. Is it received by everyone? The answer is no. There are people who are not supposed to receive the yellow fever vaccine, and here they are. One, those people with compromised immune system, especially those with HIV and tuberculosis. We are not supposed to give them because already they have compromised immunity, and once you give the vaccine, they are likely now to suffer yellow fever. Another category of people is those people who have cancer. As we know, cancer is one of the diseases that affects the immunity. Still, as we have said in HIV, these people still are going to develop yellow fever if you give them the yellow fever vaccine. Then other people have thymus gland problems. Still, they are not supposed to receive yellow fever vaccine. Then also people on treatment that disrupt immunity. For example, corticosteroid and cancer treatment, which we commonly call chemotherapy. Also, they are not supposed to receive yellow fever vaccine. Then also talk about people who have life-threatening allergic reaction to eggs, chicken, gelatin, and past yellow fever vaccine. Anyone who has allergy to eggs, chicken is not supposed to receive yellow fever vaccine. Then also pregnant mothers and breastfeeding mothers, they are not supposed to receive yellow fever vaccine. Then we talk about people who are 65 years and above because of low immunity. Also, they're not supposed to receive yellow fever vaccine. Once you give them, they are going to suffer yellow fever and you'll have caused the disease in them. Lastly, the people who should not receive are the children who are younger than 9 months. If you are to give children this yellow fever vaccine, they should have reached 9 months and above. Once they haven't reached that 9 months, still they have low immunity and they are going to suffer the disease. And this is our last slide, where we're now talking about complications of yellow fever. If someone is left untreated, what are those complications that result from yellow fever? One is high fever, which you call hyperpyrexia, and this one is going to make cells to die. Next, there is pain in the upper part of the abdomen. This person is going to complain of abdominal pain, especially in the upper part of the abdomen. This person is going to continually vomit, and this vomitus is black, or it looks like tea, coffee ground vomit. So this person terribly vomit, and this is just due to bleeding, and the black color comes from the blood that is coming from the blood vessel. Then another complication is bleeding, and this bleeding will lead to the next complication, which is dehydration. And another complication we shall talk about jaundice, which is the yellowish discoloration of the skin due to too much bilirubin deposition. Then there is kidney failure, there is liver failure, and lastly, death. If we don't manage someone with yellow fever, these are the complications that will appear. So to wind up, we have seen the management of yellow fever, and we have talked a number of things. We have seen people eligible for the vaccine. We have seen those who should receive, those who shouldn't, preventive measures, and complication. Thank you for listening. Let's meet in the next video, as we shall be talking about something new, and follow that information on the YouTube channel that is displayed, and we shall be meeting for more suggestions. Subscribe to the link to get more videos. Thank you.